Hello and welcome to Baby and Rojas Orthodontic Specialists. Congratulations on choosing the Invisalign product as your choice of appliance in your orthodontic journey. Today we'll be starting you on your way to that great smile. But first, we want to share with you some rules when using these aligners. In order for the aligners to effectively grab and move your teeth, attachments will be placed. These attachments come in many sizes and designs and will be placed on your teeth where they are needed to get the effective movements to improve your smile. You will receive a series of individual trays that you will change every 5 to 14 days depending on the instructions that you receive from your orthodontist. Each tray must be worn in a sequence. For example, tray 5 must be worn before tray 6 before tray 7, and so on. If by chance you lose, forget, or are not sure what tray you are currently looking at, each one of these trays is labeled for you. If you put the tray up against some white background, you will see that this tray is labeled 05, and it has a U in front of it. That is the upper 5th tray. This tray is labeled 05 with an L in front of it. That is the lower 5th tray. When placing your trays, never bite them into place. This can cause the trays to become distorted or stretch, and as a result, your tooth movement will be slowed down. Always use your fingers to place your trays. Once your trays have been seated with your fingers, you will be using another placement aid called Chewies. Chewies come in two forms, a long form and a shorter form. Chewies are used a little like gum, and what you do is you use them to squeeze the trays into place. You will feel the trays seating better, and you will cause the trays to sit better so that your optimum movement can be reached. Chewies are to be used 10 minutes a day, 3 times a day, or twice a day for 15 minutes. Many of our patients find it effective to chew while watching TV, driving to work or to school, or while on the computers. Some patients have even chosen to chew them like gum during school, which they say helps them focus. When removing your trays, it is important that you remember to always remove your trays from the inside of your teeth. By using the opposite finger, always unlock the back of the tray by pulling straight down, back of the tray by pulling straight down, and then just use your fingers along the back to remove your tray. On the bottom teeth, use your fingers like a claw, lift up one side, and then lift up the other side and remove your tray. Not removing your trays by the inside can cause your trays to distort, improper movement of your teeth, or cause your gums to recede. So it's important that you always remember to remove your trays correctly. Your aligners come with a case. Many varieties and colors of cases are supplied, but remember the most important thing: when your aligners are not in your face, they're in the case. During your treatment, you may be asked to wear elastics. Elastics are a very important part of moving your teeth because they allow the doctors to apply different forces to the arches and move the teeth faster or more effectively. Elastics will come in clear or colored options. I have a colored option here to show you exactly how to place your elastic. Your elastic will go from a slit that is in your Invisalign tray, which is right here. I'll point it with my thumb. So you will hook it on, just like that. And then many times there's either another slit or a button on the opposing arch. There are a variety of patterns and locations that you'll wear elastics on, and everyone is individual. So please ask if you have any questions. Not wearing your elastics will equal slowing down your treatment. It is important that you wear your trays a minimum of 22 hours a day. Anything less than 22 hours can result in your teeth not moving as they should, and eventually the trays will stop working as well as they are intended. The only time your trays should not be in your mouth is if you are eating or drinking. The only thing that you should drink with your trays in place is flat, plain water. Sparkling or carbonated water or drinks, as well as juice and milk, can pool between the trays on your teeth and cause decay or peeling of the enamel. When playing sports, you can keep your trays in your mouth, unless you have to wear a sports guard. Then you remove the necessary tray, but continue to wear the opposing tray. When you remove your trays, you can soak them in a diluted solution of 50-50 water, and we recommend Optic White. You'll find that if you soak these trays while you're brushing your teeth, your trays will be nice and clean and fresh when you put them back in your mouth. We also recommend that at nighttime you use a Prevident 5000 Plus toothpaste. This toothpaste is to be brushed on your teeth for 2 minutes just before bed and then spit out the rest. Do not rinse. When you place your tray in, it's like giving yourself a home fluoride treatment in order to keep everything nice and healthy while you are wearing your trays. In between soaking your aligners, you can use a toothpaste and cool water or baking soda mixture with water and brush inside of your aligners. So, for a quick review, your aligners are to be worn 22 hours a day. Use your chewies for twice a day for 15 minutes or 3 times a day for 10 minutes, minimum. Wear your elastics, how you are instructed to wear them. Never bite your aligners into place, and always, always, always remove them from the inside. And most of all, enjoy your new smile. Thank you from Dr. Baby and Dr. Rojas and team.